And probably again, over this pandemic, we'll probably be doing another session next year, I'm guessing. So stay tuned, and we'll probably have updates again next year as well. So I'd like to remind the audience that we're not taking any questions, live questions. Everything will be done through Slido. So if you have any questions, you can start adding them into the Slido app now. And we will be compiling them and asking the speakers your questions at the end of each of the sessions. So we welcome all of your questions, and we really want to get started now, because I know that each of the sessions are going to be full of really interesting data and information. So the first speaker today is a friend and colleague who I worked with at Baylor College of Medicine, and I'd like to introduce Dr. Peter Hotez. Dr. Hotez is a professor of pediatrics and molecular virology at Baylor College of Medicine in Houston, where he is also the co-director of the Texas Children's Center for Vaccine Development and the endowed chair in tropical pediatrics. He is a vaccine scientist who is the lead, who's led the development of vaccines, and in fact is working on a COVID-19 vaccine right now, which is in getting ready to submit to the FDA. It is undergoing EUA right now. And together with Maria Elena Battazzi, he's working on this vaccine, and we're really hoping that things move forward and quickly for this vaccine, because it's so needed, and I'm sure that he will maybe mention something about that. Dr. Hotez obtained his undergraduate degree from Yale and his MD and PhD from Weill Cornell Medical College and the Rockefeller University. He's he's published numerous books, and he's a National Academy of Medicine member. And many of you have probably seen him very frequently on MSNBC and CNN and many other news outlets. And so we welcome him, and he is going to be presenting his presentation live virtually. So Peter, welcome, and I just can't thank you enough for being here with us today. Thanks so much for being here with us.
Well, thank you very much, Melissa, and I appreciate your coming back virtually from Stanford to Texas, and we miss you a lot here at Baylor College of Medicine. We understand that Stanford University is supposed to be a pretty good university, but we still miss you a lot, and glad you're retaining some links to Texas still. That's very meaningful to all of us. I'll just speak for a little bit, I think about 10, 15 minutes, about where I think we're headed right now with COVID-19 in Texas nationally, and then just very briefly globally. You know, we've just gotten through a pretty horrific episode of the pandemic here in Texas over the summer. What happened was the Delta wave really swept through the summer in Texas and in the southern part of the United States, actually just more or less with the same timing as it did last year. Different variant. Last year was the original variant, now it's the Delta variant, but same idea. And it does impress upon me that maybe there is some true seasonality to this virus, but the reason Delta gained such a strong foothold here in Texas and the southern part of the United States partly is because of its high transmissibility that everyone's hearing about, but ultimately it's because of vaccine refusal. And the number that I'm pushing hard on to get people to understand is that since June 1, 2021, June 1 of this year, 20,000 Texans have needlessly lost their lives because they refused to get vaccinated and contracted COVID and lost their life. I mean, that's an extraordinary number, and it's based on, and if you want to rederive the number yourself, all you need to do is go to the Institute for Health Metrics COVID-19 tracking website. It's healthdata.org. Run your cursor and your mouse over the two dates from June 1 to now, and looking at the cumulative deaths, and you'll come up with something over 20,000. And then the Texas DSHS, which has been Texas Department of State Health Services, which has been reported in the Texas Tribune, also finds that 85% of the deaths from COVID in 2021 in Texas are among the unvaccinated. And that's how you get the number. And, I don't really know words to describe it. It's, we call it misinformation or disinformation. This is self-immolation and an attack by anti-science forces. And I think we have to recognize now that anti-science is, on that basis, has become a leading killer of young adults in the state of Texas. And we've got to work some public health around that. And as academics, I think this is the hardest thing for us to talk about, because it's clear this is coming overwhelmingly from the far right, and this does have a strict partisan divide in Texas and elsewhere in the South. And of course, all of our training as physician scientists says we don't talk about these things. But if it's killing that many people, I don't see how we don't talk about it. And finding a way to feel comfortable discussing it and addressing it, I think, is going to be absolutely critical, because we do things like combat global terrorism and nuclear proliferation and cyber attacks, and anti-science is now killing more Texans than all of those forces combined. And I think that's got to be a priority. Now the numbers have gone down, but they're going to start coming up again, I just like they did last year around this time. And we're going to see now yet another big Delta wave, I think, in Texas, because we've still profoundly underperformed. We only have about 54% of the state vaccinated, but the state really has two dimensions to it. They're the urban areas, and along the border, it's higher, over 60%. But you look in some of the central Texas counties, some of the East Texas counties, it's 40% vaccinated, 30% vaccinated. So there's a lot of, as I would say, warm water for the Hurricane Delta to pass over. And that's what's going to happen. We're going to see another big wave of deaths in Texas as we head into the winter months. Again, all of them tragically preventable, I'm sorry. Then, in addition to that, now we've got the Omicron variant, which the county judge here in Houston, Lena Hidalgo, announced last night was detected in the wastewater here in Harris County. That's how it's a very innovative way to pick up new variants, and that's what we're doing here in Harris County. So, to no surprise, Omicron is here. Exactly what happens with Omicron, I think, remains to be seen. I think on the one hand, in parts of South Africa, it's been highly transmissible and has outcompeted many of the other variants of concern, just like Delta outcompeted Alpha earlier this year, and Alpha outcompeted the original lineage. So one of the big questions is, will Omicron outcompete Delta in terms of transmissibility and become the new dominant variant? I don't know that. If it happens, it's not going to happen right away, because Delta is so highly transmissible. So I think the way I see this unfolding as we move into the winter is we'll have both in play. We'll have Delta and Omicron around for a while. And I think Omicron's fitness advantage, to use that evolutionary term loosely, is the fact that it does have lots of mutations in the spike protein, and therefore I think it will disproportionately cause COVID reinfections among people who've been infected and recovered but have chosen not to get vaccinated. And I say that because that's what we're seeing in South Africa. We're seeing lots of reinfections with Omicron. So I think that's one. So we could potentially have two populations of people infected. The Delta disproportionately more the unvaccinated, the Omicron disproportionately among those who've gotten infected and revaccinated and not gotten vaccinated, or those now who have gotten 2 doses of either the mRNA vaccines and have had a significant waning immunity. Now, if they've not gotten that 3rd immunization, potentially they are going to be susceptible to Omicron. And so the bottom line is this: whether or not you're concerned about Delta or Omicron or both, your strategy right now is really the same, which is, number one, if you've not gotten vaccinated yet, you're lucky that you've not gotten seriously ill. Now's the time to get vaccinated. Don't wait. Second, if you've been infected and recovered but not gotten vaccinated, get vaccinated because you're going to be highly susceptible to Omicron reinfection. And there's a lot of misinformation out there about the benefits of infection and recovery. I think the immunity is tenuous. And we know now that even from Delta, people who've been infected and recovered, and you're twice as likely to get reinfected compared to people who've been infected and recovered and gotten vaccinated on top of it. If you've gotten 2 doses of the vaccine but have not gotten your booster and you're an adult and therefore eligible, get it because that booster, that third immunization, will give you a 30 to 40-fold rise in your virus neutralizing antibody. That's going to help you both against Delta and I believe, and it's just an opinion at this point, it's going to help you with Omicron as well. So I believe the numbers will show that if you've gotten 3 doses of mRNA vaccine and you do have that 30 to 40-fold rise, there's going to be enough spillover antibody or cross-reacting antibody to help you through Omicron. And we don't know that yet. So for our vaccine, we're looking at that, as is Pfizer and Moderna and J&J and all the others. And we'll get some early hint of whether there's going to be some cross protection just based on laboratory virus neutralizing antibody data fairly soon. And then lastly, get your kids vaccinated if they're eligible, if they're over the age of 5, because we've seen Delta hit kids very hard and it's coming back and we don't know its impact on kids. We've seen a lot of kids in South Africa with Omicron get infected. And then lastly, globally, our vaccine, we are expecting it to be released soon for emergency use authorization in India. This is one we developed at our Texas Children's Center for Vaccine Development at Baylor College of Medicine. It's a recombinant protein vaccine that uses an older technology, a yeast fermentation technology used to make the recombinant hepatitis B vaccine that's been around for 40 years and parents have been giving it to their kids. And here it's a vaccine that we hope that could be made locally across the world's low and middle income countries. So we've licensed it without patents to Biological E in India, in SEPTA in Bangladesh, to Biopharma in Indonesia, and to Immunity Bio, which is building out vaccine development capacity in Botswana. So we hope this becomes one of the truly first people's COVID vaccine for global health, and we'll be making more announcements about that soon. So I think I'll stop there, and that way we can go through the panel and leave lots of time for questions. I know people have a lot of questions about COVID-19 vaccines, and happy to answer them.
Thank you so much, Dr. Hotez.